Are you getting lower back pain when you wake up in the morning? Are you finding pain in the outer hip? Maybe the pain in the deep buttocks, one or both sides. And now those first few steps, going to the washroom, is challenging. Getting out of bed, the posterior hip, the tightness in the legs, the heaviness in the legs, the stiffness that you're feeling. And guess what? A generic back stretch is not going to do the trick for you, because this is typical of an L5-S1 issue and a morning signature that happens because that S1 nerve root is being affected, that piriformis muscle is getting tight on you, and sleeping for those 6 to 8 hours of night and now trying to get up has created this stiffness. Watch my video today. I'm going to show you my top 3 morning stretches that you're going to do, and by doing these stretches, it's going to have a huge impact on your S1 nerve root, and it's going to help you start the day in the way you need to start it. My name is Dr. Alykhan Shariff. I'm a local chiropractor in Oshawa, Ontario. My clinic name is Infinite Healing Chiropractic and Wellness Center. And the basis of today is to show you how you can start your morning without any pain or less pain than what you had when you woke up with. I'm going to get you to like this video. I'm going to get you to subscribe to this channel, because you're going to see that I'm going to keep on pouring out more and more content that's going to help educate you on how to take better care of yourself. Today, we are talking about a specific approach to a specific level, and that is the L5-S1 level. The morning is when the L5-S1 symptoms are typically the worst, and when the right sequence of stretches makes the most meaningful difference to how the rest of the day unfolds for you. And so today I'm going to show you 3 stretches. All 3 are chosen specifically for the L5-S1 anatomy. All 3 sequenced to address the overnight accumulation pattern that this level produces. So make sure you follow them in this sequence. Now, the big question is, why does L5-S1 overnight accumulation occur, and why is it different? There are 3 biological mechanisms that produce morning stiffness in all stenosis patients. So this overnight inflammatory accumulation, the cold protective muscle guarding, and the central canal being in the most compressed position at the moment of rising. For all L5-S1 specifically, all 3 of these mechanisms are applicable and in play. And that's why you get this typical type of a morning symptomatology. So let's understand this a little more. The L5-S1 facet joints and the L5-S1 disc are the primary inflammatory generators at this level. So overnight, without the movement that would typically be occurring through the day that would drive the lymphatic clearance of any inflammatory mediators, any type of cytokinins, any inflammatory mediators that these structures produce, a concentration of cytokinins, chemical irritants around the S1 nerve root peaks right at the moment of waking, because it's been accumulating. So that S1 nerve root, that structure, is most sensitive because of this accumulation in the morning, which is why the deep buttock aching is occurring, the posterior hip tightness is occurring, and the early leg heaviness. And this characterizes an L5-S1 morning that we see in patients that have this type of symptomatology. The one thing to also understand is also the piriformis muscle and how that tightens overnight. That piriformis muscle is the key secondary compressor of the S1 nerve root at L5-S1, because as the S1 nerve root is going down your leg and going through the buttocks, it actually travels underneath the piriformis muscle, or in some cases, pierces that muscle. So during sleep, the external hip rotators, including the piriformis, maintain a static hip position for the duration of the sleep. So in a patient with an established piriformis involvement at L5-S1, this static overnight holding pattern produces a specific pattern of morning tightness in the posterior hip that is different from any general lumbar paraspinal guarding that all stenosis patients normally experience. So that's why when I show you these 3 stretches, That piriformis muscle is part of those stretches. The piriformis wakes up tight. The S1 nerve root passes either through or beneath it. And this combination produces specific outer hip and deep buttock morning achiness that a lot of L5-S1 patients describe. The 3 morning stretches for L5-S1 are sequenced deliberately. The first stretch targets the piriformis before you stand, releasing the overnight tightening before the body weight is applied and before any walking begins. And that walking and that standing can start to compress an overnight already sensitized S1 nerve root further. That's why we want to do this stretch first. The second stretch mobilizes the L5-S1 joint, driving that inflammatory clearance at that level. So it allows that inflammatory accumulation to start getting out of there. And then the third stretch opens up the L5-S1 foramen through a rotation-assisted movement that no static flexion stretch actually achieves. So this sequence builds from the piriformis release to joint mobilization to the foraminal opening. It's a logical, clinical progression from the outermost compressor to the innermost one. The first stretch is performed on the edge of a bed. So it's called the figure 4 seated piriformis stretch, and it's done before you stand. And the timing is clinically specific, not arbitrary. That's why you've got to do this first. And what you're going to do is you're going to sit on the edge of the bed. Your feet are going to be flat on the floor. You're going to cross your right ankle over your left knee. You're going to put your right hand and you're going to press it on the right knee and gently downward. You're going to feel that immediate deep stretch in the outer right hip and buttock. And that piriformis is going to start to release from its overnight tightening. And you can hold this for 30 seconds. You're going to breathe slowly. Now, the next thing you can also do is that you can gently lean forward from the hips, not the back. You don't want to round the back, hinging at the hip to deepen that stretch. And you're going to switch sides, and you're going to do it on both sides. And why do you do this before standing? Because when you perform the figure 4 in a seated bed edge position, the S1 nerve root is still in a relatively decompressed configuration. And there's been no weight put on it. There's been no axial loading on it. None of that's been applied. So because you are in that seated position, you haven't started standing yet, that piriformis muscle can be stretched when that nerve is at, and it's actually decompressing, and it's the most tolerant to handle that stretch tension. So standing and walking first and then trying to do that stretch means that you're going to irritate that S1 nerve root that's already sensitized, and it's going to create a much more difficult stretch for you to do. Now, let me show you how to do this stretch. Now, when I show you how to do this stretch, I will be sitting on a chiropractic table. You can do this sitting on a chiropractic table. You could do this sitting in a chair. You could do this sitting on the edge of the bed. But I prefer for this sequence and this particular sequence of stretches, this is done before you get onto a standing position or before you start walking. So that's why it's done on the edge of the bed. So let's show you how to do it. Today I'm going to show you a fantastic stretch that you can do, which helps to relieve the piriformis muscle tension. If your piriformis muscle is hypertonic, if that S1 nerve is being irritated by that muscle. And it's the seated figure 4 piriformis stretch. And Sarah here is going to demonstrate this for us. So basically for this stretch, what you're going to do is you're going to take your knee, your ankle, you're going to put it above your knee, not on top of the knee, and you're going to be sitting straight. And you want to, if you're in a chair, you want to be in a straight back chair. You can do this while you're working at a desk job. You can do this in the morning when you get up, right when you're sitting on the mattress and stuff, on the edge of the mattress. And basically, you want to have your hand on your knee, and your whole motion is going to be at your hips. You're going to lean forward at your hips. At the same time, you're going to put a gentle pressure on your knee down, and you're going to feel that stretch in that piriformis muscle. And this is a fantastic stretch to do. The second stretch is the cat-cow, but with a modification that makes it specifically different and more effective for an L5-S1 client or patient than the standard version. And I'm going to explain to you what's different. The standard cat-cow flows rhythmically. You inhale to neutral, exhale to cat. Continuous movement. But for an L5 stenosis patient, L5S1, the cat phase is the most therapeutically important. It is when the L5S1 foramen opens and the S1 nerve root receives the decompressive window. And so in a standard flowing cat-cow, that window lasts for approximately 1 second, and then you move to neutral. But for an L5S1 client, I change it. And what I'd like to have it is that you hold that for 3 seconds before returning. That 3-second window gives the inflammatory mediators that have been accumulating around the L5S1 nerve root and joint a sustained stimulus to clear with each repetition. The rhythmic compression and decompression of that posterior joint space drives that stagnant fluid out. So it's kind of like a pumping mechanism that starts to occur when you're doing that cat-cow, but holding it for 3 seconds. So now I'm going to get you to watch while I show you how to do this stretch. So the exercise we're going to show here is the cat-cow, but with a variation. And the variation is that when you're in the cat position, you're going to hold that for 3 seconds. Rather, in the cow position, you hold that for 1 second. First, let's show you what the positioning is all about. Now, if you have knee issues, you can find yourself using a pillow, and that's totally fine. Underneath your knees, that just gives you support. With that being said, the positioning is you want to be on all fours, hands underneath the shoulders, knees underneath the hips. Now, breathing in and breathing out is also very important in this too. So when you're in the cat position, you want to round that back, tuck the chin in, and breathe in. And when you're in the cow position, you're going to drop that abdomen, extend the head back, and you're going to breathe out. So this is your cat, this is your cow. So going on all fours, again, hands underneath your shoulders, knees underneath your hips. And when you're going into the cat position, you're going to round the back and breathe in, and you're going to hold this for 3 seconds. And then you're going to drop that abdomen, extend the head back, and that's your cow position, and you're going to hold that for 1 second. And again, going into the cat position, hold that for 3 seconds, breathing in, and then breathe out into your cow position. And this is how you'll go through rhythmic contractions, 3-second hold, and then a 1 second hold for the next position. Now, the third stretch is the one that is most specific to the L5S1 of anything in this morning protocol, and it is the one that sometimes is missed in a lot of generic lumbar stretches. So that's why I'm going to show this to you, and it's important that this is the third one you do after the first two. So what you're going to do here is while you're laying on your back, you're going to draw your knee, it could be your right knee, towards your chest and towards the same side chest, and hold it for 20 seconds. This is the standard knee to chest. Now you're going to move that right knee to and drop it across to the opposite chest area, the opposite shoulder area. And that right hip is you're allowing to rotate internally, and the pelvis to rotate slightly to the left, holding this crossover pattern for another 20 seconds. Here is the clinical mechanism that makes this specific to L5S1. When the knee drops across the body towards the opposite shoulder, it produces a combined hip flexion and internal rotation movement that specifically widens the L5S1 foramen. And so that is crucial when you're dealing with stenosis. So the pelvis rotates away from the crossing leg, and the L5S1 joint opens, and it opens asymmetrically on the right, and the right S1 nerve root receives a targeted decompression that a bilateral knee to chest cannot produce, because you can add that rotation in with a single knee. So the L5S1 foraminal stenosis, which is frequently asymmetric, worse on one side than the other, this type of a stretch is clinically important, and it helps with that decompression on that area. And you're holding it for 20 seconds each way. And you're going to do it both ways. And here, I'm going to show you how to do this stretch. So watch as I show you. Stretch I'm going to show you here is the single knee to chest. Very simple stretch. You can do this in the morning, but very simple on how to do this. Basically, what you're going to do is you're going to get onto your back. And you can do this on the bed. You can do this on the floor. When you're in this position, you're going to bring your knee to your chest. And now you're going to grasp your knee. You're going to grasp it below the knee with your hands. You're going to hold this position and you're going to let gravity do all the work. You're not going to force it. And as you're breathing in and breathing out, you will feel that knee get closer to your chest. Basically, you do this while you're on the mattress, getting up from sleep in the morning. You can do this on the floor. You want to bring your knee to your chest. Now, your hands are going to be grasping just below the knee. And then when you do this, you now want to bring that knee to the opposite shoulder. And you're not going to force it. You're just going to allow gravity to do its effect. And as you're breathing in and out, you will feel, first and foremost, that knee get closer to the chest. You will also feel that stretch through that pelvis area. And this is a great stretch to do. And obviously do this stretch both sides. So you're doing the bed edge figure 4 before you stand. And you're going to hold that for 30 seconds each side. And you're going to release that piriformis muscle. Then you're going to do the cat-cow, which has a 3-second hold. And then you're going to move into the single knee to chest and then move that to the opposite shoulder. Again, holding that too. This is an important clinical protocol stretching program that you should do every morning if you're suffering from these. But these 3 stretching levels are specific for what they work with, and they're continuously done in the morning, and they address the piriformis tightening, the L5-S1 joint inflammatory accumulation, the foramen decompressing. But while they do all of that around the structural reality of what's going on, they also don't do everything you need it to do. And what do I mean by that? Well, you have disc height loss that could be occurring. You could have arthritic facet joint changes. You could have foraminal narrowing. You could have bone spur accumulation. All these are still there. That's not going to change. And the worse the structural pattern, the worse your symptoms can be. And what am I alluding to? Well, stretches is extremely important, but stretches is not going to be completely useful unless you're also getting therapy. And you should be seeing somebody for therapy. At our clinic, at Infinite Healing Chiropractic and Wellness Center, we see patients that come in with stenosis. Now, when we talk about the stenosis that they're going through, the stretching is important, and it's important to do the stretches, but the protocol of getting the chiropractic is also important too, because of the fact that we first will do an assessment. We'll do the history, the physical assessment, the x-rays, the spinal scans. We'll get MRI reports if they're applicable. All of this to understand what the issue is. But then what are we doing as chiropractors? Our game plan as chiropractors is to target specific areas in the nervous system. And what happens is when the joints in your spine starts to get misaligned, these nerves start to get affected and start to get irritated. And guess what? We talked about that foramen getting narrow. We talked about that foramen getting narrow and that spine, the nervous system, well, the nerve in particular, getting irritated, getting compressed. Well, do you not think that when this joint is misaligned, that nerve could also further get compressed? That area where that foramen is, where that nerve is exiting through there, that area could be getting smaller just because of this misalignment too? And so the chiropractic therapy, by moving joints back into alignment, restoring proper motion in that nervous system, but also taking pressure off of that nerve and widening that canal where that nerve goes through, makes a difference for stenosis patients, makes a difference for any type of patient that could be suffering from that, even your disc herniations, even your disc bulges. all of these types of patients are going to notice a benefit when they're incorporating their chiropractic care with their stretching program. Stretches doesn't replace your therapy. Stretches adds to your therapy, so therefore you can further the progression. Very important to understand that. So what I would always say is that you need this compounding effect. The therapy, the stretches, 3 stretches, sequenced for L5-S1 every morning before you leave the bed. Very important. Figure 4, okay? Right when you're sitting on the edge of the bed, then you go right into the cat-cow, holding for 3 seconds. Then getting into the knee chest, and then moving that knee over to the opposite shoulder. These 3 sequential stretches done in that order make a difference for your morning and get you ready for your day. The generic morning stretches may not be effective, but the targeted morning stretches that I'm giving you today give you a better start to your morning where you can start moving on and do the things you need to do. If you found this morning protocol to help you, then please share this video, tell others about this, but more importantly, like this video, subscribe to this channel, because I will continue to provide information that can help you get better and help you live a functional life. My name is Dr. Alykhan Shariff. I'm a local chiropractor in Oshawa, Ontario. My clinic name is Infinite Healing Chiropractic and Wellness Center. I'm looking forward to seeing you on the next video, and I'm going to keep on educating you. Thank you for joining me today.